Good morning, America, and welcome to this morning's Going on Offense webinar. My name is Daryl Moon, and it's my pleasure to be with you today. As we have been mentioning for the last few months, the best healthcare system model in the world is the aspirational healthcare model. Superior outcomes at half the cost. South Central Foundation's NUCA system of care in Alaska is the best example of a aspirational healthcare system. They are the only healthcare system that has won the President's Malcolm Baldrige Award twice, once in 2011 and again in 2017. Countries come from all over the world to Alaska to learn how the NUCA system of care can be so much better than all the other systems and only cost half with far better outcomes. Wouldn't it be nice if we could all purchase healthcare from the South Central Foundation's NUCA system of care? Well, we can't. However, we can take a close look at how they manage healthcare and apply similar models to the healthcare benefits we purchase for our employees. The foundation of the NUCA system of care is a relationship-based healthcare system. Having a relationship with your doctor or someone in the healthcare system can be a powerful antidote for the fear and anxiety that accompanies any interaction with the healthcare system, especially if you're experiencing a major event like a major surgery. Well, today I have as my guest panelist, Lee Jacobson, the founder of Coba Health. When I learned about his dedication to building relationships with patients and holding their hand as they go through these traumatic medical events like a major surgery, I wanted to have him join me for one of these webinars. Lee, thank you so much for joining us today. Would you like to take a few minutes and introduce yourself and Coba Health?
Sure, Daryl, thank you. It's great to be on with you today. We founded Coba Health about 6 years ago. I had spent my entire career in surgical services, working mostly for Johnson & Johnson's orthopedic division, and spent time in about 20,000 surgeries or more, and really got to know that world well. Many of the patients that we met with were anxious and uncomfortable, didn't know the process, and so I think this is a great topic for improving healthcare is building that relationship. Just a little background on Coba Health: we have providers in 49 states across every specialty. We vet our providers very carefully using quality metrics, looking at infection rates, complication rates, readmission, patient satisfaction, and we work with self-funded employer groups who need to improve quality and reduce costs. And what we found in that process is that one of the major components is the patient experience. And you stop and think about it, and the patient is central to everything. And most times the patient's thoughts and feelings and concerns go completely overlooked. So at Coba Health, one of the things that we do is we have a team of care coordinators. And when a potential surgical patient calls us or contacts us, they are assigned to a care coordinator who is dedicated to that patient throughout the entire experience, finding a surgeon, scheduling appointments, post-operative appointments, and so forth. They have a single point of contact that builds a relationship with that patient and helps them in several more ways, which I'm happy to go deeper into with that. But it's a major component, I believe, of our success and of having patients who are happy and who feel like they actually matter and are a part of what's going on.
Well, and share with us a little bit about some of the feedback you hear from the patients on how they appreciate having someone that's holding their hand.
Yeah, it's we strive to delight our patients, And that's our motto. We want them to have a delightful experience, and they're not used to this. We hear over and over, "This is the best healthcare experience I've ever had. I didn't know it could be like this." And so some of the things that we do as our care coordinators work with patients one-on-one is we talk about the different surgeons and facilities that are available, what maybe some of the pluses and minuses might be with some of those. We talk a lot about the patient's home situation. What are their needs? What are their fears? What are they anxious about? What do they need to take care of? What is their timeline to get this done? We can't just assume that because they're here today, they want to get it done as quickly as possible, or and just get on schedule. There are many factors throughout their life that are being affected by a surgical event or any traumatic healthcare event. And so our care coordinators are trained to be very sensitive to that and ask questions and listen. And I think as we talk with patients, they love the experience. They love knowing what to expect, first of all, and what to prepare for. They love knowing that everything's being done according to their time frame and their desires, not by the time frame and the needs of the system that they're in. So we have people that cry on the phone once in a while that just are having such a good experience. We also strive to save them money. Our model creates a zero out-of-pocket for the patient for this surgical episode of care. And I think that's a big deal. The financial aspect for the patient is enormous. And we find that a lot of patients are really fretting over a $5,000 or $6,000 deductible, not knowing how they'll pay it, putting really needed care off, and suffering in the meantime, and a lot of these conditions are worsening as they wait. So the financial aspect is huge, but more than that, knowing that they can call in and talk to their care coordinator anytime, they can text them after hours, and it's a very personalized service that makes all the difference for these patients.
Well, and I think so often we really miss how critically important relationships are in the healthcare system. We want to focus on the procedures, the outcomes, but the relationship is the foundation. What I love about the NUCA model that is proven to be the best healthcare system in the world is they simply said, let's build a relationship-based healthcare system. And to the members, when you speak to the members of the NUCA system, one of the first things they tell you when you ask, well, what's it like to be a part of this? It's like, I have a team of a doctor, a nurse, a scheduler, a coordinator, a medical assistant. That's my team. I know them personally. They know me personally. I have their phone numbers. I can text them anytime. And there is nothing more important to me than the fact that I have an immediate access whenever I need them to my team, and the whole healthcare system is behind them, and they will coordinate everything behind that. And you've basically, for surgeries, built that similar type of a model for people that are having a major medical surgery. Well, NUCA built it for the entire healthcare system. I'll share with you, when I get in front of business leaders, and again, I speak to business leaders all the time across the country. I love to speak to CEOs, usually a group of 15 to 20. So I've spoken to over 1,000 CEOs across the country, and I asked them, why do you spend all this money, and what do you want? What's the most important reason that what's the most important thing you're trying to get for the money you're spending? And the number one thing they say is, I want to attract and retain good employees. And when you ask employees, what do they like about healthcare? Those who have a relationship with the healthcare system, that's the first thing they say. It's not about, CEOs don't tell me I want it to be more affordable. That's never the first thing they say. And yet our system is so focused on cost, cost, cost. It's like, you don't understand. Business leaders will pay enormous amounts of money for their employees to feel like they have a good system there for them. And it's so easy to build that when you recognize the importance of relationships. And yet, as a medical system, we ignore that entirely. It's like, you know, call my assistant. And all you got to do is give him your cell phone. You were talking earlier about a surgeon that does that. Talk about what his experience has been.
Yeah, we have a very close relationship with a neurosurgeon in Utah who is young. He's a very good surgeon, extremely personable with his patients, takes time with them. But over and over, we've heard one of the things that the patients like best about going to him and working with him is that he'll give them his cell number and tell them, hey, if you're having a problem, don't hesitate to text me, even if it's in the middle of the night. I'm happy to take your question and help guide you through it. And it means the world to patients.
It does. I was talking to my son just a few days ago, and he goes, I love our pediatrician. That was this little 1-year-old. He goes, we love our pediatrician. Why do you love your pediatrician? What is it that he does that's so unique? He gives us his cell phone number, and we know we can call him whenever we have a need. It was like that was everything. That was quality of healthcare, was simply they had a relationship with the doctor. You know, that family medical doctor model that, you know, if we had a dad or a brother or a sister that was a doctor, and, you know, whenever we had a need, we'd call that our friend, our family member, and of course they would give us personal attention, they'd follow up with us. That's such a simple thing to build into the medical plan if you just simply use best strategies of doing that. And yet we miss it all the time. It's like it's not important. We don't even think about it. And yet to the business leader that buys healthcare, it's everything. To their employees, it's everything. It's like we miss it. It's entirely missed. So let's get into the fact that you also save incredible amounts of money. I mean, you know, when I was talking to a friend of mine recently about how you had helped his wife who needed a spinal, fusion, the bundled price of where they were first going to go, one of the prominent hospitals in Utah, was $168,000. And with your help in searching out the second best surgeon in the state, it was what, less than 30,000 when you put everything on. I mean, it's like there's an amazing difference in what you can get the very same surgery for if you just proactively and negotiate and use your service. Talk a little bit, how is it that healthcare can be so $168,000 versus less than 30 for the very same surgery? How is it that healthcare can even do that?
Yeah, it's just they charge those amounts because they can, and they get away with it over and over, and the system is made so that you and I don't ever see those amounts that are paid. But it makes cost go up for everyone. So with our model, we save an average of 40% based on the BUCA averages. We're an average of 40% lower than those.
So let's clarify. You're not talking about 40% less than the retail rate. You're
right.
talking about 40% less than the network contracted rates.
Exactly, and that's in a bundled format. So our bundle includes pre-op visits with the surgeon, post-op visits, the surgeon, the facility, anesthesia, implants, and we take that patient out of network for that event, and for those particular services. And then when they fill their prescriptions on the way home, they use their standard insurance card from their network plan, and they're back into their plan. So, but 40% is very significant. The average savings that we have per surgery is about $12,000 per surgery that we save. So you can imagine where that goes when you've got multiple people coming through your system.
Well, and there's no question when you look at hospital or healthcare spend, there's what, 50% of the people that really don't use any healthcare. And then there's a small percent that use a lot of it. Well, when you look at what they're doing to spend so much money, it's often the major surgeries. It's
Yeah.
those big ticket items that cost so much for everybody. If you can carve into those big ticket items at the level you're talking about, 40% off of the network contracted rates, that can make a significant difference in the total cost. And again, NUCA, best healthcare system in the world, they can do healthcare for half the price with far better outcomes. Well, how is it that they do that? It's because there's a coordination and there's an effort as a team to bring the best services. You can't buy NUCA if you're an employer, but you can buy pieces of the NUCA system and you can implement strategies that will bring an aspirational benefit to your employees. And that's really the key. You can't buy a one-off, here's, I'm just gonna buy it, but you can put together a plan that brings that to the table.
Absolutely.
So let me ask you whether or not you feel like the advent of accountable care organizations, the ACOs, and the fact that through Medicare, the government's basically saying, hey, hospital systems, start working together. Has the advent of ACOs helped bring about the ability to bundle in your situation? Do you feel like that's made a difference in opening the door for services like yours?
Oh yeah, absolutely. I think bundled rates are definitely on the increase. We're seeing more and more of those. They're definitely not mainstream. They're definitely not every day, but we are seeing more and more as we contract with providers and facilities. Many times we'll call a facility and contract for pricing, and they'll ask us if we want their bundled pricing. And for us, that's fantastic. It simplifies our job, but I believe it's going to lead to lower cost and greater transparency in the system when people can shop and see those prices and see what the whole thing includes. Because up to this point, they've been looking at the surgeon fee or the facility fee, and not getting the complete picture of this entire episode of surgical care.
Yeah. Well, let's talk a little bit about, historically, healthcare providers have been leery of bundling everything into an upfront price. And I love your strategy. You literally pay it up front. I mean, that doesn't happen. And yet when you can say, I will give you the cash before the surgery happens, to the provider, it's like, great, I got cash on hand. Now, what if there are complications? And historically, we haven't wanted to bundle things because we haven't wanted to take the risk, because what if there are complications and how do we really know what the costs are going to be? I think the ACO movement has sort of helped with putting hospitals at risk and saying, look, we're going to take some responsibility for some of those, not great outcomes. Tell me a little bit about your experience with hospitals when it comes to assuming that risk under a cash bundle price.
Well, they don't like to do it. That's the bottom line. They don't like to do it, but they're being forced to do it through Medicare, and I believe it's helping everybody increase quality of care. That's becoming more top of mind. Maybe not for all the right reasons. It may be driven more by monetary gain than patient care, but certainly patient care becomes a part of it when we're looking at what is the best care we can give that patient for the best outcome, rather than what's the perhaps the least expensive care we can give that patient. So hospitals don't like it, but they have to live with it. And I believe that across the board, we're going to see an increase in quality because hospitals are on the hook if there are complications. And so it's just another indicator that more things are going to be seen in a bundled format, especially when it comes to surgical costs.
Let's talk about the inverse relationship in healthcare between quality and cost. Normally, when you spend more money, you get better quality, like in a house or a product that you're buying. If I'm willing to spend more money, I'm going to get better quality. it's been amazing to me, even as a hospital administrator, those who do a procedure over and over and over are often have much better outcomes and are able to do it at a bundled price for a much better price than the doctor who does it infrequently. And when they do it, they have more complications and they wind up having more alternative services that are needed. It's just amazing how with healthcare, just because it's less expensive doesn't mean it's not better quality. And in fact, in many cases, it's better quality because they know what they're doing and they've done more of them.
Yeah, absolutely. And throughout my career, I've seen that over and over as I've worked with surgeons all across the country and seen kind of the good, the bad, and the ugly. And you think about a surgeon, for instance, that only does total knee replacement. That's all he does. He's extremely good at it. He's extremely fast. He has a team that's very efficient. They don't waste supplies. They don't waste time. They don't make mistakes because that's what they do, and they are honed in 100% on giving that the very best care with the highest efficiency and best outcomes possible. And that's the type of team that we like to work with because, like you said, there is an inverse relationship there. Those teams and those specialists that are focused in one area and they're focused on increasing outcomes and improving them, as well as reducing costs. We find that efficiency creates better outcomes and lower cost without a doubt across the board. And in these scenarios, the outcomes are markedly better than a system where, for instance, an orthopedic surgeon is doing an ACL and then he goes into the next room and starts a total knee replacement, and then he goes to the next patient and does a rotator cuff replacement. And I'm not trying to be down on those people, but if you're looking at efficiency, outcomes, and cost, the specialist that is a specialist in a specific thing and has a team that's with him provides the best outcomes at the lowest cost.
Well, and talk a little bit about the quality outcome measures you track. And you mentioned before we started the conference some of your numbers.
Yeah. We use quality metrics for all of our surgeons. So if any of our members are sent to a surgeon, we know how that surgeon comes in, what his score is as far as infection rates, readmissions, outcomes, ER visits. Post-operatively, we've got good data on all that. So we choose the best surgeons in specific geographies to work with, and I think that's a big benefit to the patients. We were just looking at our latest numbers a couple days ago, and we have a 0.4% complication rate. So that includes readmissions, infections, any type of complication, reoperations, and it's extremely low.
Which means 99.6 are going well.
Exactly.
That's a lot of good surgeries that are happening.
Yeah, it's very satisfying to see those numbers, and it tells me that our system's working. Not only aligning people with good surgeons, but that their experience is good, and that post-operatively they're getting better, they're getting back to function, and they're doing it without problems.
Well, and let's talk for just a second about the fact that you've had experience in medical tourism, and for years medical tourism has been a real interest by a lot of self-funded employers, but there's some complications associated with sending someone across the state line or to another country to get a surgery. You've really worked on building the ability to keep their people in the community to where they stay where they live. Talk a little bit about that.
Yeah. Well, we started out sending patients to Mexico. We would send them to Cancun, to a great hospital facility. We'd send a U.S. surgeon with them to do the surgery. It was a great situation, but we realized that most employers don't want to take the risk of sending someone out of the country, and most employees don't want to take the risk, and their families don't want to assume that risk as well. So we started building a network throughout the U.S. and what we are, you look at Walmart and Home Depot, and they use a system called Centers of Excellence, where patients travel to a U.S. destination that is really good at a particular procedure, and that's where they go. Our concept is more of a local Centers of Excellence, where we find the best providers on a local level, where most patients don't need to travel ever, and they're able to get the best care within a 100-mile radius of where they live, and not have to travel. The travel really is disruptive to their life, and as we talk with patients, nearly every one of them wants to stay home. They want to be home the night of the surgery, if possible, to recover and not even have to stay overnight. So we work on a lot of same-day surgeries, surgery centers that will do same-day procedures, but being close to home and being able to get home soon after that surgery, and not have to make arrangements like, who's going to take my dog while I'm gone? Who's going to go with me to surgery? Who's going to take care of my kids and mow my lawn? And there are 100 considerations that you have to think about when you're going to leave town for a week or two for surgery, and so it gets very complicated. Not to mention, when you get home, and if you have a complication, who's going to take care of that? Because at that point, the local providers don't want to touch it.
Yeah. No, good point. So we're running out of time. So maybe in the last few minutes, Lee, is there anything that you want to share that we haven't had a chance to address?
Well, Daryl, when you told me about the NUCA system, I loved what I was hearing, and I was really satisfied to know that perhaps we're just doing our own little miniature NUCA system in our little niche, and it's working really well. I'm so impressed with what I see with NUCA, and hopefully we can mirror some of their experience and successes in what we do. But I think it's the future of healthcare. It's patient-centered, it's efficient, it's cheaper, and it's better. And so I'm glad to be associated with the aspirational healthcare and being able to do our little part for our members and for their employers. So thank you for having me on.
Thank you. So in closing, let me just mention that our next webinar will be in 2 weeks on Wednesday, June 16th. We'll be talking more about this aspirational healthcare model. Please join me on the 16th at 10:30 a.m. Mountain Daylight Time, and you can register through goingonoffense.com. That will be up and available in the next day or two. I'm also pleased to announce that Orion is organizing a virtual aspirational healthcare conference this summer, July 14th and 15th, where we'll be highlighting the NUCA system of care and other similar systems that have gone beyond our traditional deficit-based healthcare system. Representatives from the NUCA system who have been there for 20 years building it will be the keynote presenters and be participating in the conference to share insights that they've learned over 20 years in building the best healthcare system in the world. If you're interested in learning more and registering, go to aspirationalhealthcare.com. In fact, as a listener today of our webinar, we'd like to invite you to join the conference as my guest for free. You can use the promotional code exclamation point and then Orion, all in capitals, and $, and it will waive the registration fee. Again, that code is exclamation point Orion, spelled in capitals, ORRIANT, and $. Thank you again, Lee. Appreciate you being with us today, and we wish everyone a wonderful day. Have a good one.